Hi, everyone. This week, we're going to wrap up our chapters on ANOVA, but we're going to look at a different type of ANOVA. This week, we're going to talk about factorial ANOVAs, where you have overlapping categories of data assigned to continuous variables about units of analysis. Earlier this semester, we looked at some data where we had cat owners and dog owners indicated as to whether they were introverts or extroverts, and we had data on their quality of life. The idea of a factorial ANOVA is to compare the means of a continuous variable across two different factors of categorical data so that you can understand not just is there a difference between cat owners and dog owners or introverts and extroverts, but whether there's an interaction. Maybe it's not just enough to be a cat owner. Maybe you need to be an introverted cat owner for your score to really change. Let's take a look at an example. Again, we're only working in SPSS this week because Excel is just not as efficient with ANOVAs. This particular data set is data on nurses. This is the type of nurse. We have nursing assistants, LPNs, and RNs. Here, we also have nurses ranked on their experience, whether they're novices who have just started their job or whether they're an expert who have multiple years of experience. Here, every nurse is given a score. This score is an assessment on a range of 0 to 100, indicating the number of times nurses were able in an experiment to correctly identify a patient's pain level based on their nonverbals. We want to know whether there's a difference in nurses' ability to identify these nonverbals correctly based on the type of education they have, so the type of nurse they are, and their experience level. To do this, we're going to go to Analyze and General Linear Model. This is a tool we haven't used yet. From General Linear Model, we're going to go to Univariate. For dependent, we're going to choose our score. And for fixed factors, we're going to choose our two categorical data variables. We're going to do a couple of other things. I'm going to go into plots, and I want SPSS to create a plot that contains the nonverbal identification scores based on type of nurse and experience level. And I want it to be a line chart that includes error bars. Error bars show you the range of the confidence intervals in a visual form. We're also going to run some post hocs. We're going to post hoc for type and a post hoc for experience, and we want them to both be Tukey because they're nice and easy to translate. Continue, okay. Now that was actually silly. We don't need a post hoc for experience because there are only 2 levels, but that's okay. SPSS just won't run one. And what do we have? Find that there are statistically significant differences across group. There are statistically significant differences in the type of nurse, in their experience level, and an interesting interaction effect. How do we interpret this? Looking at comparisons across groups, we see that there's a statistically significant difference in RNs versus nursing assistants, and in RNs versus LPNs, and also the data repeats here showing that there's statistically significant difference in RNs versus the other 2 types of nurses. So it seems that RNs have the highest ability to correctly interpret this information. Here again, our post hoc shows us that the RNs score statistically significantly higher than the other 2 types of nurses. But the picture becomes much more clear when we're able to look at the plot. Again, I said these error bars are the ends of your confidence intervals. So when the confidence intervals do not overlap, we know there's a statistically significant difference across groups. So what does this tell us? It tells us that for nursing assistants, experience level does not matter. But for LPNs and RNs, experience matters. The more experience, the more expert these nurses were, the better their scores. So this tells us what that statistically significant interaction effect was. The interaction effect was that experience matters, but only for LPNs and nurses. Experience did not help the nursing assistants. So if I were interpreting this data, I would say a statistically significant difference was found across groups with an interaction effect, such that expert RNs and LPNs had statistically significantly higher ability to identify those nonverbal cues than novice LPNs and RNs. But experience did not change the score for nursing assistants. I hope this example helps to illustrate the concept a bit. Please let me know if you have any questions.